As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission, I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain, keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. I'm never gonna give up, fall down.
You're listening to the Tom Ficklin Show on WNHHLP 103.5 FM, your home for community radio.
I'm never going to give up. I do like to welcome you to the Tom Ficklin Show. My name is Bernard Macklin. Tom was so gracious to allow us to come on today as he relaxes. So we're so grateful to Tom Ficklin at the 103.5 WNHH. So I'm excited today because I have an opportunity to have two fantastic people on the show with me today as we talk about a healthy heart. And when I think about the month of February, and when I think about what February means, not just to the women, but what it means to African Americans as we celebrate a historical month of African achievements of Black people in this country and throughout the world, but also as we deal with some very serious matters in our own community as it relates to medical equity. And that's kind of what we do. We are people that deal with the realism of dealing with people that really need to focus on the very important part of their life is taking care of that heart and your body. I'm hearing that this is National Heart Month as well, and doing all that you can to protect that very delicate muscle in the middle of your chest, more to the left, and making sure that it is healthy and pumping blood throughout the body to keep you going. But there's a lot that goes into that. And a lot of times as people, we just jump aside and don't take it very seriously when it comes to medical equity. So today I brought in two of the best communicators in the city that I feel communicate very well and do a fantastic job with getting a lot of important information out to the community. And both of them helped me very dearly in my position here with Southern Connecticut State University Department of Health and Human Services through CARE. One is a fantastic person. I met him maybe a couple of years ago for the first time, and we've been working very closely since that time here at CARE with providing this community with very delicate information as it relates to vaccine equity as well, and making sure that people get vaccinated. I came to Connecticut back in 2010, and Miss Robin Moody was working in a different department at the time, but we had a chance to meet each other, but we began to work a lot closer just almost 2 years ago as well, with making a partnership between us and Cornell Scott, which is very vital in the work that we do. They are our vaccinators. And Robin has come through multiple positions since that time, but now she sits in a very important position as she's communicating this information out to you. I thought, what a great month to just come and just kick it and just sit back and just relax and talk about the importance of something that all of you are very tired of. We know you're tired of it. We know you're very tired of it, but you know what? We can't take off the gloves yet. We can't take off the gloves yet. We are not out of the pandemic. I don't want you to get it twisted or get you to thinking that it just moved on. It has not moved on. And so we as people want to continue to communicate that to you. So I asked the both of them to come on with me today so we can just kick it with you and just give you some information that we feel is very important. But before we get started, I'm going to ask Robin first just to come on and just tell you a little bit what she does at Cornell Scott and kind of the things that she's into right now. Ms. Moody?
Yes. Good morning, everyone. I'm Robin Moody Davis. I am the Community Outreach Manager for Cornell Scott Hill Health Center. And what I've been doing is coordinating. I started off doing the testing, but now we're doing vaccines. So we coordinate community wellness clinics around the city, including Hamden, West Haven, sometimes Milford, and that is to bring access to our communities because there are some people that will not necessarily come into the clinic or into the hospital unless there is something wrong, and then they normally go to the ER. So we're trying to open up that access to everyone in the community and let them know that we are here, and you don't necessarily have to come in all the time. Sometimes we can bring some of that care to you. So we do the vaccine clinics, which allow us to provide vaccines, boosters, flu shots, as well as we do screenings for blood pressure. And sometimes we bring our other departments out, which allow us to do infectious disease testing. We also are out and we can help people that need to get their insurance together. So we provide a variety of different things in the community as we open this portal.
And that's a lot of work right there, opening the portal. And I see it all the time. I deal with Miss Moody Davis all the time in the work that she does. I don't want to forget, well, I get to that part. I'm in the conversation, I come back to what I was just thinking. But I want to go right now to Jackson Higginbottom. Jackson and I have worked directly. We work in the same department. Actually, Jackson is our communications person in our department, as well as so many other things. But I want him just to come in and tell you some of the things about himself and some of the stuff that he's doing as well. Jackson?
Good morning, everyone. As Bernard mentioned, I'm Jackson Higginbottom, and I am the Vaccine Communications Lead at the Community Alliance for Research and Engagement, also known as CARE. CARE is co-housed at Southern Connecticut State University and also Yale School of Public Health. And so during the last few years, we have really been working with community partners, the New Haven Health Department, Cornell Scott, and many others within the community to really work together and make sure that the community is getting the information that is really vital around vaccines and other health resources that are available. And so, I'm excited to be here today.
I'm excited to have both of y'all because you know what? I mean, it's funny. We try to have a good time, people, as we try to do the work that we do, but I know how serious it is as well. So a little laughter is nothing wrong with it, to keep you going. So, they know me by now. But I want to get into this thing just a little bit. When you talk about a healthy heart, when you think about the heart itself and actually showing love to the community, to help them to understand that we're not against them, that we're actually for them. Kind of what do you think is important that the community should know about Cornell Scott, Robin, to help them to really understand how much Cornell Scott really care about serving the community?
Okay, so one of the things we really are trying to focus on is getting people educated about healthcare, and in doing so, opening up those doorways and that communication to let people know that it's not just about when you feel sick. Preventative care, that's a big thing. It can help save your life. It can, give early detection about different things that are going on. It can save you money. It can allow you to be there for the people that are most important to you. So preventative care is your checkups, your screenings, including vaccines. All of that is a necessary part of being healthy, having a healthy heart, and having things checked out before there's a big issue. It becomes very difficult after there's a major issue. Now you're into treatment instead.
I love that. I love that. One thing that I found years past is people didn't pay a lot of attention to preventative services. And you want to prevent something, prevent it. You don't want it just to sneak up on you when it's too late. Especially when it comes to cancer and other more serious matters that people have gone through in their families with their parents and even themselves. So actually doing that preventive services is key. Going to connect with a provider, getting to know a provider and letting that provider take care of you. So actually you don't run into something that maybe it'll be too late to take care of. Thank you, Robin, for that. Jackson, what, the same thing, when you look at it from a public health perspective, being a practitioner yourself, a very excellent one, kind of what is your perspective when you think about helping the community think about preventive care and how they can protect themselves? in the community, and involving vaccinations, involving plenty of other things.
Yeah, there are so many things that, we often put it on individuals that, they need to make sure that they are doing these things to prevent their health. But in public health, we are often looking at communities and populations, and something that, we see from the data is it's really important. We talk about, again, on the individual level, how important it is to get the vaccines or to do, have checkups or other exams. But we know it's important because we're looking population level, community level of, we're seeing these trends in the data of the people that are not doing these preventative things, or who do not have access to these preventative things. And that's really what pushes public health along is, okay, we're realizing large community member, groups of community members are having, this specific health condition. Where has the system, society failed the community? What can they do to then put policies locally to fund these types of programs or fund these preventative resources? And one really cost-effective strategy are vaccines, and this is something that we all became really familiar with during COVID, but a new study recently came out that of over 5 million veterans, that they found that getting COVID can increase the chances of heart failure by 72% and the chances of stroke by 52%. And so that just goes to show that, it's really important to get these vaccines that can prevent these illnesses, because it really not only within the disease itself, so not just the impact of COVID on your body and your heart, but it has long-term consequences too. And so it's really important to do everything that you can to prevent those long-term consequences.
Everything
Definitely.
that you can. I'm sorry, go ahead, Jack. I'm sorry, I didn't mean to interrupt. Everything that you can. I kind of like the way he ended that, doing everything you can. And that's why we're here. We're here to help you and provide you with things that you're going to need so you can be able to do everything you can in order to receive the services that you need. I haven't been here longer than Cornell Scott. Cornell Scott has been here longer than I've probably been alive. Say almost near. They got a lot of years. I'm right there.
54 years.
I think we're right there together when it comes to the number of years that Cornell Scott has been here in this community. And not only that, how long public health has been working very diligently in this community to provide you information that is crucial. One of the things that kind of get to me, y'all, that I like to talk about is everybody still dealing with the falsehood of what to believe and what not to believe. You know what I mean? What what we call it, Jackson, disinformation and misinformation, I think it is. And I'm gonna have Jackson just come in just real quickly to talk about what disinformation and misinformation is and how we can get around that.
Yeah, so misinformation and disinformation, while they're sometimes used to mean the same thing, they're slightly different. Disinformation is information that's being spread to intentionally mislead people. And one classic way to think about this is other governments maybe putting false information out to influence a country, or it could be businesses that are putting misleading information out so that more people will buy their product. But misinformation is where the information is not true or it's misleading, and but the person sharing it doesn't know that.
Right.
And oftentimes misinformation is shared because people want to make sure that their networks, their friends, their family has as much information as possible about something that's going on, even if it may not be true, but that person doesn't know that it's not true. People share information because they sometimes think it's better just to share. And sometimes, that can really have some consequences when it's, misinformation that has to do with health. So, there are some ways to go about it, but, I just want to say that like the number one way misinformation spreads is online. And it's often by people that have good intentions. Most of the time, people aren't trying to be, to share false information to hurt you. It's more so because this is the best information they have. And that goes back to the access conversation that we talked about earlier for preventative services. But, having access and, connections and having trusted health professionals that you can talk to is really important. And it really goes to prevent, the spread of misinformation, because now you have someone that you can ask those questions to, and to ensure that you're not sharing false information.
That is so important. And the reason I brought that up, and I'm glad he spoke on it to kind of give you the difference between the two, is information in our community is being distributed to confuse people, to keep them confused, but also to keep you in a place where you're not really knowing the facts. And not knowing the facts, you make decisions on false and disinformation and misinformation that may be crucial to your survival and you staying alive when things happen in our community. Miss Robin, Miss Robin, Moody Davis, you got so many names, I'm trying to keep up with it. Miss Moody Davis, kind of like what are some of those things that in your time, I mean, you've been doing this for quite some time. What are some of the things that you're still hearing when we think of disinformation and misinformation out in the community that the people should kind of stay away from?
Well, I've heard some things from females that it will alter their ability to have children later on. There's been rumors that it changes your DNA, that it puts a chip inside of you. And my question to people when they say things like that is, okay, where are the facts? Because sometimes when if there's a hesitancy about something, we tend to look for the negative. So we're going to gravitate to the things that are negative because that's going to make us feel better about not doing it. If someone says, "Oh, it does this to you," it's easier to say, "Oh, well, I'm not gonna do that." But if we try to look for things that are factual, things that can be proven, meaning you're going to need to do a little investigation. You can't just take that person's word that said, "Oh yeah, it's going to put a chip in you, or you're not going to be able to have babies," and you just run with it. We can't do that because our health, our lives are at stake. So we have to do some investigation for ourselves to find out what is factual and get educated and then make our decision. Your decision may still be, I don't want to do it, but now you can do it with a clear mind saying, I have all the facts I need to make this decision. This is not my choice, but then I have a plan, that follows up for that.
You know what? That's a great point. Jackson, that makes me think about a couple of things, man. When she say that, I was listening very closely to what she was saying when you talk about having the facts. Can you kind of tell us some places where can you grab these facts where people can go to channels that people may go to, websites or things like that people may go to find information just if they're just curious about something?
Yeah. I mean, I would say not to go to Facebook or Instagram. While they could be good sources if you have, if you're following trusted health organizations, but like Cornell Scott. But I would say to go to the CDC website. If you don't trust the federal government, then look at the state of Connecticut's health website. You don't trust the state's information, then look to trusted health organizations in New Haven, like Cornell Scott or Fairhaven, because I know they have a ton of health information on their websites, and they often even have phone numbers that you can call to ask your questions. And then also Yale New Haven Health has a lot of vaccine information and most like up to date health information from, for a variety of research backgrounds. And then also CARE has a website called it's vaccinateinhv.org that has some vaccine information and places that you can get vaccinated with in New Haven. And then, as always, there's the New Haven Health Department's website as well.
I mean, and I'm just curious, Ms. Moody, what is you guys' website for Cornell Scott?
cornellscott.org.
And so definitely
nice and simple.
Yeah, nice and simple. A lot of information, people. It's a lot of places you can go. And you know what, because we care, this is a month of caring. This is a month of history when it comes to positive things that we have done in this world. So we just want to make sure that we bring a lot of positivity to you all to let you know that taking care of you is the most important thing that you can do. And taking care of you, nobody can take care of you better than you can. We can provide things, but if you don't utilize the very tools and things that are out there, you're just going to be left at a point in your life where if it doesn't matter, then it's going to show up. And then at that point, it might be too late if it matters or not. We want to get to you before it gets to that point where it's nothing that we can possibly do. Cornell has been around for 53 years, actually providing information and services to this community in multiple places, and now CARE's been around for at least 17 years, providing services, but we want to provide this service to you in a way that you can benefit and that your families can benefit. But the only way things benefit, if you show up and get it. You know what I'm saying? And that's kind of why we're here. That makes me think about some things though, because it's getting rough out here. It's getting rough out here, and something that I thought about a lot over this time, that eventually this stuff is going to cost people money.
Mm-hmm.
And if you don't have insurance, you got it's going to come out of pocket. Now I know Cornell Scott has a sliding fee scale.
Yes.
That can help people that necessarily don't have insurance or need a little bit more help. How does that work at Cornell Scott?
So we do have a sliding fee scale, and if you speak to one of our patient advocates, they will sit down with you and discuss a plan for you based upon your income levels. And it's pretty simple. Also, for those that may or may not know, about a month ago, anyone that is undocumented and under the age of 18 is now covered with health insurance, which wasn't the case prior to about a month ago. As long as you're 18 and younger, insurance will be provided for that child. Also, I wanted to mention, when you spoke about some of the resources and where you can go, Cornell Scott, we have COVID-19 navigators out every day in the streets of New Haven, going in the neighborhoods. We're passing out information, but we're also there where you could speak to a real person face to face and ask them whatever question you want about COVID or general health care, more so about the COVID and the vaccines and the boosters, but they can definitely give you some referrals or phone numbers that you could call about any type of health or medical care. But if you have questions and you see them on the street, you feel free to stop them. I mean, if they give you a paper, you can ask them a question, but you'll see them, they're always in their uniforms, and you can ask them any question you might have on a personal level, and you don't have to worry about who's on the other end of a phone call or a website that you can't see that person, and you can see that person right there in front of you, their reaction, and communicate with them.
Thank you. Jackson, I'm just curious. I mean, when it comes to the public health side, how are we looking to keep this thing going? How are we looking to help people, especially now that, people are thinking that it's like the COVID is going to become more like the flu, where it's going to be seasonal, where you're going to be able to get shots seasonal. Are we at that place yet, or are we getting there? Kind of, where are we in that area?
Yeah, I mean, we are working towards, I think, really trying to figure that out. It looks like the FDA and CDC will be moving towards, annual vaccinations for the COVID vaccine. But I'm not quite sure that's been finalized yet. I really think that, I know many people are ready to move on past COVID, but it's still, really present in our communities. And, many people are dying each year, every day from COVID still. And so, while many people are able to move on, it's going to be the people that are under-resourced, who do not have, the immune systems that can really put up fights against COVID, that will, really be impacted the most by us moving on without, realizing that, this is still here. For public health, there's, always, some emerging health concern that's coming out. Over the summer, there was Mpox, formerly known as monkeypox. Right now, flu is picking up again. So, we have these cycles, but, I think it's just really important that people stay up to date with the latest information and, find their trusted messengers of health information, and, stay tuned in. There are changes. I know it gets tiring. And there's, always a new variant of concern or a variant that's spreading. But it's, this impacts the health of our communities. And I think, we need to take it seriously, no matter, what, if the country is ready to move on past it, it's still here if we like it or not.
Robin, I if I can call you Robin, Ms. Moody Davis.
Sure.
I'm just curious. I'm hearing that now you might have to set an appointment with a doctor for testing. Is that something that's happening now, or they still got centers they can go to, or is it something that they need to, if they want to get tested, that they actually have to set an appointment to see someone?
So right now, everyone still has access to the tests that are being provided by the government. So you can still order them. You can still get some in parts of the city of New Haven. We still have home tests that we give out every event. We'll be giving out. We'll be having a campaign next month where we'll be giving out tests and masks and basically like a little safety kit. But in the near future, it is being stated that as this transitions, I won't say comes to an end, but as it transitions into a new period, it is going to be something, if you need testing, it will need to be done through a primary care physician, meaning you will need to make an appointment and then they would have to order it for you. So that means, one, if you don't have primary care, you need to get it, because otherwise it's going to slow down your process for anything. So many different things require a primary care referral before you can be looked at for different specialties and things. And if you don't have that, you slow down the process, meaning that you are endangering your health every day, where you're slowing something down that could have been done yesterday or a month ago. So again, with the preventative care, we want to bring people back into care. If you don't have a primary care or never had a primary care, seek one out. It doesn't have to be with us. It could be with anyone, but it is a necessity for your health. But that is something they have been speaking about, is that the testing will need to be done through making appointments with a doctor and having it ordered.
You heard it first. I mean, at the end of the day, people, I truly believe in having my own primary care doctor that can care for me personally, a person that I can go into that ensure that I'm meeting my personal needs and making sure that I'm going to be here. Some of you parents, y'all got young babies, y'all got young children that you have to look after. But if you're not here, who's going to be responsible for them?
Right.
You know what I'm saying? The babies need to be looked after. Don't get it twisted. Let's not get it twisted. These kids need to be taken to see their doctors too. They need to be looked after and everything. So we need to get on top of that. We need to take that as something that's real serious and making sure that we're getting our kids looked at. Now, with that perspective coming up, Marvin, you guys have pediatrics at your clinics too, correct?
We do. And we do have pediatrics, and we are actually increasing our pediatric staff because we are including the pediatrics in our transition to the Q House. So that will be a service available for those of you that are in the Dixwell and New Hallville community. We are transitioning over our Dixwell office over to the Q House, and pediatrics along with other services will be available there.
You should get those babies looked at. Jackson, from my understanding, this year's been really rough as the flu, and I'm thinking I'm missing one of the areas that I'm hoping you can remind me of that really affected our kids. So pediatrics is real serious right now, and kind of help our parents understand the importance from a public health perspective with getting your kids looked after.
Yeah, thanks. The definitely over the winter and going into the school in the fall, we were seeing these rising cases of RSV, and also we've started seeing rising cases of flu. And I'll pull the latest numbers just so we'll have it in a minute. I'll give you that update, but anything that we can do to keep people out of the hospital is obviously what we want to do. We want to make sure people are getting the vaccines that they can use to prevent some of these illnesses. But there are many other things outside of vaccines that we can do. Washing your hands often, wearing a mask, especially if you have been traveling, or if you're around people that you are unsure of their vaccination status or immune health. It's really important to do these other things to also prevent the spread of whether it's COVID or flu or RSV. Masks do work. There are not harmful side effects of wearing a mask. And as a lot of misinformation might try to spread, it's really important to do all these things in combination to really keep our communities healthy.
Keeping our communities healthy. That means taking care of every aspect of the communities, our babies, yourselves. And the best way to do that is, like I said, Robin said it very nicely. She said, make sure you're connecting with a primary care provider. They have plenty of primary care providers, and they have plenty of clinics. If you don't know where their main clinic is, right there on Columbus, 428 Columbus Avenue. You have the Dixwell right there on Dixwell, and they're transitioning over to the Q House. Not just pediatrics, but their internal medicine is, I believe, is also going over to the Q House to provide service, bigger space, so more people can be seen in that clinic. I'm real excited. Do we have a clue, Robin, of when that may be opening? Is it anytime soon that you know about?
The last update we had, I believe it's towards the end of March, early April.
So you know what, people, you hearing it. So somewhere around early April, we're going to go with the early April. They definitely keep your eyes on the news, keep your eyes in the newspapers.
Yeah.
With information coming out, I'm more for sure Michael Taylor's going to make sure that information is in your mailbox to ensure that you can come over to the new spot that they're going to have as they transition into the Q House. I had a chance to sneak peek over at the space, and I'm telling you, it is beautiful. They've done a wonderful job with creating such a medical environment that you are going to love for community people just like us that deserve the best. That's one thing I want to make sure that we talk about, is that you deserve the best. And I believe Cornell Scott, I've seen them grow over the years. I've seen a lot of things that has transitioned over the years. and they want you to have the best. They have plenty of programs over there. But one of the biggest ones that a lot of people miss is behavioral health
Mm-hmm.
and behavioral health for children.
Exactly. So I just want to clear something up because some people have the misconception that Cornell Scott Hill Health Center is for people that don't have income or don't have medical insurance, which that's not the case. We provide services to everyone, meaning we will provide service to those that don't have insurance with and with those that need a sliding fee scale, but we also provide for people that are working everyday people that have commercial insurance. We accept that as well. So there's no one that is going to be turned away, and the services are available for everyone. And we have a multitude of services. We have dental, we have vision, we have women's health care, we have mental health, we have addiction services, podiatry, and as we spoke of earlier, pediatrics. So we have a wealth of programs for the community. Uh, you're not going to find too much better,
Then that, I
in
mean,
my
they got
opinion.
ENT services over there. You know, their podiatry
Yeah.
services over there. I know. I used to be there, and I still love them to this day. So they, whatever you need. But the thing is that it don't mean a thing if you don't go and take advantage of it. And that's kind of what we're talking about in this month of love. We want you to take advantage of all the things that you deserve to have, and stop turning away from it because of ignorance or because of what somebody else think that don't want to take advantage of it. Your health is the most important thing that should be concerned about, because you know what, if you don't have good health, you ain't going to work, so your job ain't gonna mean too much to you. You ain't gonna be able to get there. So what we're trying to say in this month of love, make sure you're taking advantage. Excuse me, I got a cough I'm dealing with over here, y'all. Please forgive me. Make sure you take advantage of that. Okay. Jackson, I'm just curious. With a lot of the work that you're doing, what do you feel are the most important things that people can take away from this month forward? What should some of the things they should pay more attention to?
Yeah, I think early on, especially in the year, following the vaccine release, a lot of people, tensions are high. People, felt like the vaccine was being pushed on them in many cases. There were a lot of efforts that ended up getting in a lot of people's face about the vaccines or rubbing people the wrong way. And, I think while with any type of public health program or intervention, there is that opportunity for it to be implemented the wrong way, or being when we were going out doing door knocking, obviously that was something that was a bit intrusive, and so we modified how we were getting the word out about the vaccines. And so if things like that were rubbing you the wrong way, and you still have not gotten the vaccine, I would really hope that it's not for us. We are trying to make sure people have access to the information, so that you can make the decision, like Robin was saying earlier, that you can get educated and get some additional information that you might not have had when vaccines first came out. And so we're really hoping that people just reconsider and have an open mind with looking at the data that's available. There's so much information out there, and I understand how it's can be overwhelming, but the reason the people like us on this call are doing the work that we're doing is because we really believe that these type of prevention measures can really improve your health, but also the health of the community. and protect the people that really need that protection from that community health.
Yes.
Tom gave me an opportunity to speak in December, and I just came on a call by myself because there's some of the things that Jackson just shared really bothered me when it comes to missed opportunities. And a lot of things he just shared is so important that we don't miss opportunities where it may save your life.
Mm.
I don't want you to be the one that don't take an opportunity and you be the one that miss out and it may not save your life. Now, true enough, I know we are going to leave here at some point, no matter what situation in your life. Something's going to take us up out of here. But where it becomes important to me is not sooner than it need to be. If it's not your time, don't help it be your time when it's not your time by not taking opportunities that we're presenting as a team. We're a caring team that's providing services to a community that deserves it. You deserve it. Miss Robin Davis, Miss Moody Davis, can you just help Robin Moody Davis? Just help me.
Yes.
I'm gonna get that right, Robin, at some point today. Can you just kind of help us understand from your perspective some of the things that if we were to leave here today, kind of what message do you want to leave to this community that you think is very vital for them to know?
Actually, a couple of things. We still have some very vulnerable people in our population. One, people or children that are relying on adults or their parents to make the choices for them. And the group of people aged like 18 to 44, no, 25 to 44, they are still very vulnerable because that age group, that 25 to 44, for whatever reason, they feel like, oh, I'm too young. It's not going to affect me like that. It's just going to be a little cold. And it may be. But what the studies are showing, that age group between 18 and 25 and 44, they are developing heart problems at a growing rate. Every time we have a surge, that group seems to also have a surge with heart problems. Some of them have died. Some of them are actually just developing heart problems that will need to be treated with long-term treatment, medication, but there is a correlation. So people that think that, oh, if I get it, I just get it. You may be that one that if you get it, it means long-term life-threatening heart problems. So why, subject yourself to that if you don't have to? It's, you need to do that maintenance and that preventative care. It's just like when you have a car, you know that your car could break down if you don't do certain things. So you get the oil change, you check your tires, you do all these different things to make sure you have a smooth ride. So what about with your own life? Don't you want that smooth ride?
Yeah.
So the children, they don't have any choice but to rely on the choices that their parents make for them. So make sure you're making an educated and informed decision for your children, not just misinformation or disinformation. Make sure you do the research, because it would be a terrible thing to find out later on there was something you could have done to prevent a condition that your child may develop. If you had done the preventative care, if you had done the screenings and the physicals and the vaccines. So don't let that fall on your conscience. Do everything that you can do now to prevent issues later.
I want to add something to that. Yeah, I think in addition to protecting them so they don't get it, we're seeing more and more problems with people who are getting it multiple times, who are getting COVID multiple times. And so, I think some people might have had this, misconception that, once you have it, you probably won't get it again. And that's not the case, especially when there are new variants. And so, even some people think like, oh, they just had it and they're kind of invincible for the next 3 months. That's not necessarily the case. And while your body does do a good job of putting up a fight within, the first few months after vaccination, it's not impossible that you won't get it again during that time period. I went almost 2 years without getting COVID, and then I got it, and then literally exactly 3 months later, I got it a second time. And so,
Wow.
we're seeing, more of the long-term impacts of multiple infections. And there's also, we're just at the beginning of seeing the long-term impacts. Especially with COVID still spreading, throughout our communities, we don't know what to anticipate, but we know that, there are worsened health outcomes with multiple infections. So really trying to prevent yourself and, your children and those that you're around from getting it multiple times is really, what we need to be doing right now. Because in a year, 2 years, 5 years, you don't want to look back and wish you had done something differently to, prevent your family from getting sick, even if at the time you thought it was minor. So,
Right.
Yeah, excellent point. And so once I say again, if I can actually get myself clear, the sun is actually coming out and making me disappear a little bit. But I'm here, people, and I think you've heard a lot today. And as the government moves, how they're going to move, we're letting you know that how important it is to get connected to primary care. If you're not connected to a center here, if you're in the Fairhaven community, go to the Fairhaven clinics. If you are within the Cornell Scott geographical area, go to the clinics on State Street, go to the clinic in West Haven, go to the clinic on Dixwell, go to the clinic on Columbus. If you're in the Derby area, the Derby and Sonia area, they have a clinic there as well.
And Sergeant Drive.
Oh, don't let me leave out Sergeant Drive. Okay, I wasn't there. That just came up since I left, but don't let me leave out Sergeant Drive. So there's a clinic somewhere for you to make that connection in order to keep yourself healthy. Yes, clinics may dwell outside of those places as we go forward, but that doesn't mean that you don't have places that you can go every day, set an appointment and go and see somebody to ensure that those things are being looked after. Don't let pneumonia sneak up on you. Don't let shingles, for those a little elder, some of our elderly, don't let shingles sneak up on you. You know what I'm saying? Don't let COVID or the flu sneak up on you. They are prepared to provide those services for you. And between public health and between the medical side of public health, and we're going to make sure you have every bit of information that you need. That leads me to this point before we leave this call. There are going to be people out in the community that work directly with Cornell Scott, and they call it outreach workers. Our outreach team from CARE and our outreach team from Cornell Scott are canvassing your neighborhoods even right now as we're speaking. Please don't turn away from them. Give them an opportunity to stop and talk to you. They have information that we feel is important for you to have on upcoming events, medical information that we feel is important for you to have, just so you know where to go, who to see, who you can see, to make sure every aspect of your life is being taken care of. To both of you, Ms. Moody Davis, I thank you. Mr. Higginbottom, I thank you. To the both of you, we thank you that you were able to come on and share this information today. People, don't take a chance if you don't have to. Yes. Step up, step out to ensure that your life is met. Anything you guys want to share that we might have missed? Anything else before we say goodbye? And thank you for everything that you all are doing in the community. But if there's any last minute thoughts that either one of you may have?
Yeah, I just wanted to share the CDC at the beginning of February put out an announcement of a new program called Increasing Access to Community Testing. And so I will share that link right now. Let's see. Sorry about that. I thought I had it ready. If you go to the CDC's website, you can find the testing program, and this will be no cost testing for everyone. You just enter your zip code and you can find testing sites in your community. You don't have to have insurance. And so just wanted to add that as a new resource. I know it's been difficult with a lot of testing locations closing around the city. And so just wanted to plug that resource.
Make sure you take advantage of every resource, as we mentioned, that comes to you. You're great people, and we love you. So when you hug your loved ones this Valentine's Day, you love them with proper medical care.
Yes.
Get them vaccinated, get them connected to a primary care provider, get them connected to a center that's near you, and making sure you're doing your follow-ups. Don't be a statistic when you don't have to be. We love you. And all I would say to you is, take care of yourselves. All right?
All right.
Peace.
Thank you, Bernard.
Stay safe, everyone.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up.